we will discuss on first aid related with heart, blood, and circulation. Myself, Biswas, Department of Zoology, PPN College. Heart and blood circulation. The heart is a muscular organ situated at the center of chest. It acts as a pump for circulation of blood. It is divided into 4 chambers. The right chamber is called the right atrium or right auricle. Receives impure blood from all parts of the body through blood vessels called veins. These are the veins. From these veins, it receives blood. When the heart contracts or beats, the impure blood is passed into the right lower chamber called right ventricle. So this is right ventricle. And from there, blood passes into lungs. From here, the blood passes into lungs, where it is purified. During the process of purification, it gives up carbon dioxide and takes in oxygen. The purified blood then enters into left upper chamber called the left atrium or auricle. It then passes into left lower chamber called the left ventricle. So this is the left ventricle. And from there, in the course of the beating of heart, the purified blood is discharged into various blood vessels called arteries and capillaries. These vessels convey purified blood for the nourishment of all cells of the body, including the heart muscles. Blood pressure. The pressure in arteries varies with beating of heart. When the heart contracts, the pressure in the arterial system increases. When the heart relaxes, the pressure in the arteries decreases. The pressure exerted on the main arteries is known as blood pressure. It is recorded by blood pressure measuring instrument called sphygmomanometer. This is sphygmomanometer. So blood pressure is measured by this sphygmomanometer. Normal average pressure of an adult is around 120 by 80 millimeter of Sg. The blood pressure has 2 values. One value that gets when the heart contracts and it is known as systolic pressure. And the other value we get when the heart relaxes is known as diastolic pressure. The blood pressure has 2 values. Pulse. With each heartbeat, blood enter into arterial system. Most of the arteries are placed deep in the body, except on the wrist, elbow, neck, temples, groin, and near the ankles. So arterial pulse is felt over the lateral side of the wrist. So it is felt only in few places where the arteries are on the surface. So the pulse can be felt on the lateral side of the wrist, in the neck, temples, groin, and near the ankle. When a person is in shock, the pulse may not be felt except carotid artery in the neck. Carotid artery, C-A-R-O-T-I-D, carotid artery in the neck. So during shock, the pulse may be felt only in carotid artery and not in other places. The blood. The living human body contains different types of fluid. Blood is one of them. It circulates in a closed system formed by the heart, arteries, capillaries, and the veins. An average adult has a volume of 5 to 6 liters of blood, which constantly circulates. The blood is a thick, viscid liquid of bright red color when it flows from heart to arteries. So the purified blood is bright red in color when it flows from heart to arteries and becomes dark red or purple when it comes back to heart via veins. So the impure blood is dark red or purple in color and it comes from veins to the heart. It has saline taste. The blood cells which carry hemoglobin, which enables the cells to carry oxygen, are red in color and are known as red blood corpuscles. So these are the red blood corpuscles. The RBC or red blood corpuscles are red in color due to the presence of hemoglobin. Hemoglobin binds with oxygen and helps in carrying the oxygen. So hemoglobin is present in RBC, red blood cells. The other cells are white blood corpuscles, WBC. These are the WBC, which play a role in the defense of the body against infections, and platelets. So these are the platelets which help the blood to clot. The remainder yellowish portion of the blood is called plasma, which contains protein, enzymes, and other important substances. Clotting of blood. When a blood vessel is ruptured due to injury, it constricts in order to prevent excessive loss of blood. At a first stage, platelets come into contact with the damaged blood vessels wall and become sticky and start to clump at the site of the injury. Injured tissue cells at the site of wound together with the clumped platelets trigger a series of complex chemical reactions that result in the formation of fibrin fibers. So these are the fibrin fibers. Strands of fibrin come together to form a mesh which traps blood cells. The blood cells get entangled in the fibrin fibers, and that is the clot. This is known as the blood clot. The clot releases a pale colored fluid called serum, which contains antibodies and specialized cells. The serum begins the process of repairing the damaged area. At first, the clot is jelly-like mass. Later, it dries out into a crust that seals and protects the site of the wound until the healing process is complete. Chest discomfort. Like all body organs, the heart also needs blood to function properly. If someone complains of a chest discomfort, it may be a sign that not enough blood is flowing to heart muscles. This is very serious and can indicate that the person may suffer from a heart attack. The blood is supplied to the heart muscles by coronary artery, CORONARY, coronary artery. So the muscles of the heart receive blood through the coronary artery. A heart attack happens when there is a blockage of the blood flow to some parts of the heart muscles. If the coronary artery are blocked, then the heart muscles may get blood supply. A part of heart muscle start to die as soon as that region does not get any blood supply. It is serious even though the sick person says nothing is wrong with him. When a person complains of chest pain, always suspect an impending heart attack. However, not every chest discomfort or pain is a heart attack. Diagnosing a heart attack. How will you diagnose a heart attack? It is not easy to diagnose a heart attack, even for a trained medical staff. Some symptoms of heart attack are, these are the some symptoms of the heart attack. The pain remains longer than 15 minutes. The pain is increased by efforts or exertion. There is relief when resting. The person is known to have cardiac problems or has been prescribed cardiac medicine. What to look for to determine whether the person is having an heart attack? You might observe the following signs and symptoms when person is having a heart attack: discomfort, tightness or pain in the chest, pain spreading to shoulder, neck, jaw or stomach. The pain might be described as of a dull, heavy or tight character. Dizziness, fainting, dizziness and fainting, sweating, difficulty in normal breathing, nausea and vomiting or distress. If these are the symptoms, then you can say that the person is having a heart attack. Then if a person get heart attack, what will you do? Safety first. Safety first. Make sure there is no danger to you and the person. Then call for help. Shout or call for help if you are alone, but do not leave the person unattended. Ask a bystander to seek help or to arrange urgent transport to nearest healthcare facility or hospital. Tell him to come back to you to confirm if help has been secured. Then provide first aid. Make the person lie down in a comfortable position or propped up position if lying is not possible. A semi-reclined position is often the most comfortable. Ask him to rest and not to move. He should rest wherever he is at that moment. Loosen tight clothing for more comfort. Reassure the person and tell him what is happening. Ask if the person is taking medication for his heart condition. If so, allow the person to take prescribed medication. If the patient has prescribed nitroglycerin with him, it is safe for him to take up to 3 doses. If there is aspirin available, ask the person to chew on an aspirin tablet and swallow it with some water. This will help the blood flow to heart. Arrange urgent transport to a nearby healthcare facility or hospital. Keep observing the person in case he collapses. What will you do when the person becomes unconscious but still breathing? Put the person in recovery position. This is the recovery position. And do not leave the victim alone and continue to observe him. What will you do when the person stops breathing? Perform CPR, which is also known as resuscitation. So continue CPR. What is CPR? Reviving someone who is unconscious or and not breathing or is not breathing normally is called resuscitation. So you can compress his chest, or you can give rescue breathing mouth to mouth. Do not interrupt resuscitation until the victim starts to wake up, opens his eyes, and breathes normally, or help trained in CPR arrives and takes over, or you become too exhausted to continue, or the scene becomes unsafe for you to continue. What are the hygienic practice that you should practice? Always wash your hands after taking care of a person. Use soap and water to wash your hands, or ash if soap is not available. Alcohol based sanitizer can be used if available. So when to refer the person to healthcare facility? Always urgently seek urgent medical assistance, or transport the person to the nearest healthcare facility when you suspect that he is suffering from a heart attack. A heart attack is a life-threatening condition. Thank you. You can refer indianredcross.org.